We're still in Africa, where Unicef has warned that children in the Horn of Africa and the Sahel could die in devastating numbers unless urgent support is provided, as severe malnutrition and the risk of water-borne disease collide. UNICEF is providing life-saving aid and resilient multisectoral services to children and their families in dire need across the Horn of Africa and the Sahel, including improving access to climate-resilient water, sanitation and hygiene services, drilling for reliable sources of groundwater, and developing the use of solar systems, identifying and treating children with malnutrition, and scaling up prevention services. Meanwhile, children in the Sahel are also facing extremely high levels of water vulnerability, and we'll have more in this report.
The number of drought hits people in Ethiopia, Kenya, and Somalia without reliable access to safe water rose from 9.5 million in February to 16.2 million in July, putting children and their families in increased danger of contracting illnesses like cholera and diarrhea. In Burkina Faso, Chad, Mali, Niger, and Nigeria, drought conflicts and insecurity are driving water insecurity, with 40 million children facing high to extremely high levels of water vulnerability. According to the latest data from the World Health Organization, already more children die because of unsafe water and sanitation in Sahel than in other parts of the world. Most people in Horn Africa rely on water delivered by vendor, on trucks or donkey. Water is no longer affordable for many families in areas worst hit by drought. In Kenya, 23 counties have seen significant price hike, toppled by Mandera at 40% and Garissa by 260% compared to January 2021. In Ethiopia, the cost of water in June this year has doubled in Oromia. In Somalia, average water prices climbed 71% compared to prices in January 2022. More than 2.8 million children across both regions already suffer from severe acute malnutrition, which means they are up to 11 times more at risk of dying from water-borne diseases than well-nourished children. Between June 2021 and June 2022, UNICEF and partners treated more than 1.2 million cases of diarrhea in children under 5 in the worst drought-hit regions. Across the Sahel, water availability has also dropped by 40% in the last 20 years due to climate change and complex factors such as conflicts, putting millions of children and families at increased rates of water-borne diseases. UNICEF's appeal to improve families' long-term resilience in Horn of Africa region and stop drought devastating lives for more years to come is currently just 3% funded. Of that, almost no money has been received for the section devoted to water, sanitation, and climate resilience. The appeal for Central Sahel region to meet the needs of vulnerable children and families with water, sanitation, and hygiene programs is only 22% funded.